The ketogenic or keto diet is a high-fat, moderate protein, and very low carbohydrate eating plan designed to force the body into a metabolic state called ketosis. By severely restricting carbs, less than 50 grams daily, and increasing fat intake to around 70 to 80% of total calories, the body burns fat for fuel instead of glucose. When glucose is scarce, the liver begins breaking down fat into ketones, which become the primary energy source for the brain and muscles. The diet also lowers blood sugar and insulin levels, which shifts the body from a state of storing fat to a state of burning it. A typical keto diet replaces high-carb foods with fat-heavy options, examples being high-fat dairy, olive oil, avocado, nuts, seeds, fatty fish, and meats. Foods to avoid are grains, sugar, pasta, potatoes, beans, fruit, and starchy vegetables. The daily ratios for this diet are roughly 75% fat, 20% protein, and 5% carbohydrates. Interestingly, the keto diet was originally developed in the 1920s as a treatment for epilepsy. As epileptic seizures occur when brain neurons fire uncontrollably, the metabolic changes from this diet, including those increased ketone levels, reduce this excitability, decreasing the symptoms that come along with epilepsy. This method of treatment for epilepsy is still being used today. A 2026 study from Hahn and colleagues followed the effects of the keto diet on children with drug-resistant epilepsy. It was a human clinical cohort study with a total of 128 participants that were split into a keto group and a control group. Children were routinely visited with nutritional coaching over a period of 6 months and were assessed for seizure activity, cognitive function, safety, and electroencephalogram improvement. The keto diet showed greater effectiveness in managing seizures, enhancing those electroencephalogram readings, and improving cognitive function compared to the traditional control group. This study ultimately highlights that the keto diet has effects on real-world health conditions. Although the keto diet might be known for its effects on epilepsy, did you know that there's a potential for the keto diet to treat other illnesses? A 2024 study from Alavito and colleagues examined the keto diet in patients with chronic migraines to seek association. The study was to test whether the keto diet has a relationship to reduced pain frequency in those with chronic migraines. This cohort-style pilot study selected 25 migraine sufferers aged 18 to 60, which were recruited as volunteers for this research. Alavito and colleagues sought to test the anti-inflammatory properties from the high-fat nature of the keto diet in relation to the migraine pain intensity. Strikingly, the improvement of migraine seemed to be strongly correlated with the increase in ketonemia values due to the diet adaptations. The table shows that during the 8-week dietary intervention, participants experienced a steep drop in both how often they had migraines and how intense those migraines were, with the biggest improvements occurring in the first 4 weeks and continuing more gradually afterward. At the same time, their blood ketone levels rose significantly early on and then leveled off, suggesting that the diet quickly induced ketosis and maintained it. The stats test, all with p-values below 0.05 except the later ketone change, indicate that nearly all these shifts are unlikely to be due to chance, kind of pointing at an association between the diet, those increased ketone levels, and the decreased migraines. Another area of developing research regarding the keto diet is its relationship with mental illnesses, which was researched by Sethi and colleagues in a 2024 study. In this human single-arm trial with 23 participants, the study aimed to assess the connection between the ketogenic diet and mental illness, specifically schizophrenia and bipolar disorder. The 23 participants received instructional materials, a collection of well-known keto cookbooks, a list of resources, recipes, and a personal coach for the duration of the study to determine the association between mental illness and the keto diet. Participants were advised not to tally calories, but to decrease and track carb consumption to roughly 20 grams, not including fiber, daily. Consume 1 cup of vegetables each day, 2 cups of salad daily, and were prompted to drink 8 cups of water a day. 79% of participants with initial symptoms experienced significant clinical improvement, with greater rates of improvement noted in the adherent group, which continued the diet for a longer duration of time. The charts show that both adherent and semi-adherent patients improved over 16 weeks, but the degree of improvement differed depending on the clinical measure. On the clinical mood monitoring scale, Both groups started with 100% symptomatic patients, and by week 16, about half of the adherent group and slightly more of the semi-adherent group were classified as recovering. In contrast, the Clinical Global Impression Scale showed a much stronger effect of adherence. 91% of adherent patients were rated as very much improved, compared with only 50% in the semi-adherent group. Overall, adherence was associated with substantially better clinician-rated outcomes, even though both groups showed some level of recovery. Overall, these areas of research are ever developing, as we have yet enough evidence to draw a conclusion that the ketogenic diet can directly impact mental illness and chronic migraines in the same way it does with epilepsy. This is still very exciting, as the connections between nutrition can go just beyond the stomach. It highlights the correlation between the gut and brain axis. The famous saying, "You are what you eat," goes beyond what people see physically. What we eat could possibly be a huge factor in affecting brain activity and function.